I never went back, and I started staying with family in my car, everywhere else. I did go through homeless assistance through Butte County. I thought it was going to be something like that, where it was kind of like, you know, you're on your own until you need the funds.
In Angelica's case, she was homeless, so immediately set them up with a housing navigator so that they can find stable housing. Start the process of a shelter, getting connected with a provider, or food, or blankets, clothing, because we do deliver all of those stuff.
Specifically for Angelica, her story is amazing. She has little kids. She was living in her car, and she was able to get housed, and her children, that they continue to grow in safely, and they know that they're loved and supported by not only their mom but our entire team.
My name is Angelica. I go by Angie. I was born in Orville, and I grew up in Gridley. I lived with my mom. My dad wasn't really around. It was always just me and my mom. I was with my kid's dad for a few years before she passed away. We lived with my grandparents after she passed away, and then my stepdad separated me and my brother. We kind of drifted apart when my mom passed away. I dropped out of high school.
My name is Jessica Castellanos. I work at Ampla Health in the CalAIM department as a lead case manager. My role as a lead case manager in the CalAIM department is to support, show guidance, coordinate care to individuals and families in need, just be a patient advocate to make sure their needs are met.
My name is Victoria Sanaland, and I am the CalAIM Nursing Supervisor for Ampla Health. My primary responsibilities as the CalAIM Nursing Supervisor is to ensure that all of our patients' clinical and non-clinical needs are met via Ampla, via outside resources, community support referrals, through different agencies and different healthcare organizations to make sure they're holistically cared for.
I had my first son when I was 19. I was living with their dad and my kids, and we had a house in Gridley. It was just a toxic relationship, and it wasn't good for the kids. So eventually we did split up, and he moved away to Reno, and then I was living with just my kids in Gridley. When we started going to court for the kids, a lot of stuff came up, and I did lose my kids for a little while because of a suicide attempt, but I did seek help instead of going through with it. Yeah, because I couldn't do that to my kids. Well, when he took the kids, I jumped into another relationship that was no good. I gave up my house because I wanted to move out of Gridley. I did move to Woodland for a few months. I was just being in that house that held like so many bad memories. I just didn't want to be there no more. So I applied for a house in Woodland, and I moved in with the boyfriend, and we lived together. And he got custody of his kids, and that was great. I've supported him 100%. But it took a toll on me, not having my kids and having to help with somebody else's kids, that it caused a lot of issues with our relationship, and we did break up. And I wasn't gonna tell him, well, you need to leave with him having his kids, so I just left. And I never went back, and I started staying with family in my car, everywhere else. And then I started, just living everywhere. It sucked. It was really hard. It was embarrassing. Yeah, it wasn't great. For hotel rooms, food, whatever I needed, I did DoorDash for that because I did have a car. And then, yeah, occasionally staying at my grandma's house or my aunt's house and with family. I knew a lot of spots. I mean, I guess growing up in Gridley, you know all the hangout spots that, you know, where cops don't come and stuff like that. But I don't think I ever based where to stay off of safety, especially because it was just me. If I did have my kids, you know, I would think about it a little harder. But if it was just me, I didn't really think about where to stay.
In Angelica's case, she was homeless. She was couch surfing from family to friends. So we were able to help her find stable housing.
Like when I was able to bring them home for a visit, I would take them to my grandma's house. I didn't let my kids stay in a car. Or like I said, their dad would get me hotels in Reno. But no, I never let them stay in a car with me. My kids are honestly the only reason that I seeked help. Other than that, I don't think I would have made it. Oh, I have a lead case manager, and she's been very helpful throughout this whole process. I mean, she's been a lot of help, and I really like her. Anytime I do have a question, she does, you know, she gets back to me. During the housing navigating thing, she was very helpful, always, you know, got back to me. It's nice to have that, you know, the reassurance, like, you know, that something is gonna come up, or just how to go about, like, my situation. My current caseworker contacted me, and she's been very hands-on. Well, any questions I ask, my caseworker is there for that. I know that we have in medical insurance, I'm starting to see all my specialists. They're just making sure that I take care of myself health-wise, and that the boys are taken care of health-wise too. So I've applied many places, I've had a few interviews. Yeah, I do have a good job opportunity. I just need my DED and a vehicle to get there. But I do have a really good job opportunity dealing with mental health.
The role of the lead case manager is just that, to lead the care for the patient entirely. And they work with other care coordinators in the process. More specifically, in the case of Angelica, I did offer support to Jessica if and when she needed it for her. I assisted the coordination with outreach when they wanted to provide the Christmas gifts to her children and any household needs that she may have around the holiday time after she moved into her new apartment that Jessica assisted her to get.
Well, the outreach department was nice enough to adopt a family. They, in this case, chose Angelica. They were able to provide her with a bed, toys, and gifts for her children, which that is something that she was struggling. She didn't know how she was able to provide Christmas for them. So that definitely helped her out. They were able to provide food, clothing for her as well. So it really did make a big difference.
Well, they came and they actually brought me these 2 chairs and a bed for my son. And they brought the kids so many gifts, some that they still haven't even opened. They haven't taken out the boxes yet, but it was nice. It was overwhelming. It was really overwhelming. I wasn't expecting that much stuff, but they filled up the kitchen with like pots and pans, and they filled up under the tree. The kids loved it. They were so happy because I didn't know how I was gonna do Christmas, especially with all these new bills like PG&E and rent. I had no idea how I was gonna do Christmas for the kids. They made the kids happy, but me, I was just really overwhelmed and really grateful. My uncle was here helping them bring everything in, and he saw me just kind of standing around because it was a lot to take in. when everybody left, he kind of just gave me a hug and it made me cry. But yeah, it was just really overwhelming. It was me just asking like, why are they helping me? Even when I was with the kid's dad and we were together in the home, I was the one figuring out how to pay rent without a job. I was figuring out how to pay rent, how to pay for the bills, how to get the kids what they needed. So yeah, it was weird for me to be receiving help, and it still is.
There's a lot of different challenges that we face as a team. The shelters are full. The community support referrals, they take time. Time is a big thing. We want to help our patients immediately, but we can't always.
I didn't think it was like gonna happen. I did doubt the program. I didn't, I guess because I did go through homeless assistance through Butte County. I thought it was gonna be something like that, where it was kind of like, you know, you're on your own until you need the funds. Having Jessica to, you know, kind of be the middleman, that was helpful because she would answer my questions. She would ask me questions and like kind of, you know, little reminders of like what I needed to do. And I feel like there's so many other people that could be helped, like that are in worse positions than I was in. I kind of feel like, you know, my decisions got me to where I was, and so that's why I didn't feel like I deserved any of it. I didn't think it was going to happen until it finally happened.
It is a process, nothing comes easy, but at the end of the day, it feels great to know that you helped an individual or family find stable housing.
CalAIM has helped me and my family a lot, and I really do appreciate the program. And I wish I had a better way to explain it to other people, because I get asked a lot, oh, like, how are you finding all this stuff? And I'm like, I don't know how to tell you. They found me. Because that's what it feels like. It feels like, you know, I know the program, I qualified for it because of, you know, like mental health or whatever it may have been. But I know that it's that, like, I don't know how to explain it. I don't know how to explain it to people. I just know that I admitted myself to a hospital and then they found me a few months later.
Specifically for Angelica, her story is amazing. She has little kids and she was living in her car, and she was able to get housed, and her children, that they continue to grow in safely, and they know that they're loved and supported by not only their mom but our entire team.
Yeah, they've seen the worst part of me, and like they tell me all the time, like, Mom, you're so happy now. And it melts my heart. Like, you know, I hate that they had to see the worst of me to see this, and that part is really hard. And it sucks that their dad can't be supportive, and I don't expect him to, but I still want to see him do better, because, like, you know, he's his dad, and you would think that he would want that for me. I've been clean off of drugs for 2 years. When I separated from my kid's dad, I was using a lot, more to, you know, try to be numb. Same with alcohol. But one day I just woke up and I couldn't do it to myself no more. I knew I wasn't being present with my kids, and that broke my heart. And I looked at my kids and I'm like, that's the last time I'm using. I used to not want or ask for help, and I've realized that it's okay to ask for help, whether it be mental health, or, you know, with the housing and all this stuff that I was blessed with. Literally, like I said, I was not expecting any of this to come from the CalAIM program, especially because I had no idea what it was. But I've learned that, yeah, it's okay to ask for help, for any type of help. I think that I try to, you know, just have a small group of people that, you know, are there for me 100%. And I don't, my family, my kids, friends, the programs that I've reached, or that have reached out to me, are my biggest thing right now, my biggest support right now.
So as the CalAIM nursing supervisor, in order to ensure that we are providing the same comprehensive care to all of our patients across the board evenly, I do meet daily with the lead case managers, as well as our program director, our CalAIM clinical consultant, and our program manager, to ensure that the patients do have what they need, to ensure the lead case managers have the support they need to be able to provide those things for the patients.
I have family members that in their past, you know, they were homeless or they were addicted to drugs. So just being able to help others, because I wasn't able to help them, is just fascinating, and I love doing it.
Well, a year ago I was, you know, jumping back and forth from house to house, so it's helped tremendously, and yes, I'm happy with my progress. I am proud of myself for staying clean, but there's still more that I want to do. You know, there's so much more that I want to, you know, I want to finish school, and, you know, might even consider going to college, you know, but it's, there's a lot more I want to do. Don't give up. Don't give up and exhaust all your resources. Find whatever resources are available and really exhaust them. If anybody has been through, you know, what I've been through or even worse, if Ampla doesn't find you, I really suggest that, you know, find the resources and reach out, because they will, you know, help you in any way that you can, and it's okay to ask for help.